Hello, everyone. Welcome to another um, clinical discussion for stroke, for acupuncture, management and prevention. We continue with prevention. Okay, Mom Tricks, please do the honors. Okay, let's enumerate the symptoms of wind stroke due to yin deficiency with wind disturbing internally. So this is also a very common pattern of stroke. Mom Tricks?
Ah, Doc, is this, oh wait, parang iba ata siya.
Ano na yan? Part 2.
Here, this one. Okay. It's hemiplegia, facial paralysis. Is it? Yeah. Hemiplegia, facial paralysis, stiffness of tongue with speech difficulty, tingling and numbness in one half side of body, trembling, insomnia, dizziness, hot sensation of hands and feet. Tongue is red with scant or no coat, and the pulse is ready, wiry, or ready, wiry, rapid.
Okay, the pattern of the stroke here is yin deficiency, which has progressed to wind, internal wind. No? So if
Mm.
you notice, there are symptoms that are printed in bold letters. So we have trembling hands and feet. So this is very, very characteristic of a wind disorder. Irritability. So this is also wind, insomnia, dizziness, tinnitus, hot sensation of hands and feet. So it's very easy for us to know the tongue picture because um, of the picture, no? The red with scant or no coat. So this is definitely yin deficiency. Okay. Hmm. What are the treatment principles for the pattern? Mom tricks.
It's to nourish liver and kidney, subdue liver yang and wind.
Okay, so if you notice, if one, this is particularly, this is particularly common among the elderly, no? So we all know that if you have been working too hard when you were younger, and so there's always the possibility that the kidney would try to um, make up for the liver yin deficiency, no? Liver blood deficiency, rather. So this time you have to nourish the liver and kidney, and of course you have to manage the manifestation, which is liver yang and yin. So can you mention the points?
It's the points are kidney 3, liver 3, heart 7 and PC 7, do 26, PC 6, spleen 6, heart 1, Li 11, Sanjiao 5, bladder 30, gallbladder 30, gallbladder 34, Li 15, Li 19, Li 4, bladder 60, stomach 41 with dry coat and constipation, kidney 6, ren 23, and stomach 25.
Thank you very much. Okay, what are the three patterns for wind stroke due to attack of Zhangfu organs? So this is like viscera stroke, no? What are the three patterns?
The first is phlegm and fire, obstruction stroke. The second is phlegm and dampness, blocking the mind of the heart, or yin obstruction stroke, and yuan qi exhaustion with false shen.
Okay. Now let's go to another pattern for stroke, phlegm and fire blocking the orifices. So what are the symptoms?
The symptoms are sudden onset, coma with snoring, hemiplegia, convulsion of limbs, limb stiffness, constipation, red face, fever, heavy breath, restlessness, agitation. Tongue is red or crimson with yellow and greasy coat or dry, sticky coat. And the pulse is wiry, slippery, and rapid.
Okay, so if you have comma or if you have snoring, no, comma with snoring, that's definitely due to phlegm and fire that are blocking the orifices. So I think those are the most common symptoms. Treatment principle for wind stroke due to phlegm and fire blocking the orifices. Hello.
I mean, andun siya sa
Yeah, treatment principle.
saying siya. Phlegm blocking.
Yes. So definitely you have to remove the heat or clear the heat, resolve the or
Hello, Doc.
yeah, can you hear me?
Yeah, medyo choppy. Is it the same as sleep apnea? The phlegm blocking? Or is different?
Yes. But with sleep
Okay.
apnea, you
Yes.
also expect the lung qi to be very deficient.
Yes. Uh,
Make sense? Any comments?
yes.
In fact, kanina, I had a patient here na medyo, she was complaining of na kasi the husband was like telling her na she snores a lot and she has liver qi stagnation.
Mm,
So when you look at her tongue, talagang
mm-mm.
so yun. Definitely, it's not easy to treat the phlegm, no? It takes time, takes months. Kaya some people are saying you
Mm-mm.
cannot treat snoring. All I can say is that it will take a lot of time. You just have to be patient, or you should learn how to
Mm-mm.
do it already, how to get rid of the phlegm.
Mm-mm.
So you don't rely only on the acupuncture treatment, but you need to also do something
Mm.
about your diet and also how you deal with emotions, di ba?
Yes.
Kasi, like, if you're sad, okay, what is the impact ba of sad on chi? So
Mm.
that chi will be dissipated. Nagsuslow down or
Mm.
nawawala ang chi. So pag nawala ang chi, you will have stagnation, right? Or
Okay.
blood,
Yes.
yeah, blood deficiency. So expect talaga na walang nourishment. Okay? So what are the points to treat wind stroke due to phlegm and fire blocking the orifices? So the first one would be, this is very, very common.
Do 26 excess Schuan, PC6, stomach 40, REN 22, liver 3 with urination. If with urination difficulty, use REN 3 and LI4.
Okay, Sichuan is an extra point. Sichuan. Next,
Sichuan.
what? Now let's go to, this is still related to the previous pattern, but this time it blocks the, the Shen or blocks the, another term for this would be phlegm and dampness, attacking or there's a term like, yeah, basta it impacts the Shen. So medyo nasisiraan ka na ng ano dito. So what are the symptoms?
Um,
Blocking the mind of the.
sudden,
Mhm.
sudden onset, semi-coma or coma, hemiplegia, constitutional yang deficiency or damp phlegm, flaccid limbs, cold limbs, grayish complexion and dark lips, lots of sputum. The tongue would be dull dark with white greasy coat, and the pulse would be deep, slippery, and deep moderate.
Okay, what particular symptom here would differentiate this from the previous pattern in the
The
orifices? So this time we have
the pulse and the tongue,
the tongue.
the tongue, it's dull dark.
Yes. Treatment principles for Wind stroke due to phlegm and dampness blocking the mind of the heart.
We should extinguish internal wind, resolve phlegm, induce resuscitation, and open the orifices.
Okay, so you have to treat the cause. You also should treat the manifestations. What are the points? Phlegm and dampness blocking the mind of the heart.
Do 26 in Sichuan, PC6, clean 36, stomach 40, REN 4 or REN 6. If with difficulty expectorating phlegm, add REN 22.
Okay, easy. So number one on our list would be you need to use Do 26 and Sichuan, but I would prioritize stomach 40, di ba, the cause.
The phlegm for
And
phlegm.
also for the manifestations, you use REN 22. What are the symptoms of wind stroke? This time we go to Yuan Qi exhaustion with false Shen. That means your primary Qi is now exhausted.
There would be sudden loss of consciousness or coma, flaccid limbs, cold extremities, cold sweats, incontinence, stool, a shortness of breath. The tongue would be dark purple with white and greasy coat. The pulse would be scattered or faint pulse or deep and weak.
Okay. False Shen. So that means walang there's no connect between the Yuan Qi exhaustion and the mind, no? Treatment principles for wind stroke due to Yuan Qi exhaustion with false Shen.
REN 4 and REN 8.
Yeah.
Moxa.
Treatment principle muna tayo. Since this is Yuan Qi
Sorry.
exhaustion, we have to benefit the Qi. Yeah. And then restore the Yang. Now let's go to the points.
Okay. The points, REN 4 and REN 8 or with Moxa, stomach 36, Do 26, and PC6. If with irritability, C-Shen.
Okay, fill in the blanks. This is with regards to types of stroke in Western medicine. Blunt strokes are more common than
Ischemic stroke and hemorrhagic stroke.
yes, very good. Blunt have poorer prognosis, ischemic or hemorrhagic.
Hemorrhagic.
Risk factors for stroke. One pa din ang
cigarette smoke,
hypertension, no? Atrial fibrillation. What's atrial fibrillation? Diabetes mellitus, cigarette smoking, hyperlipidemia, use of contraceptives, systemic diseases with hypercoagulable state, genetic factors. What are the major causes of stroke?
Atherosclerosis is a major cause of stroke. It causes thrombosis formation and contributes to emboli. Ischemic stroke accounts for 85% of all strokes. Hemorrhagic strokes account for 15%.
Okay, did you know that if you are on anticoagulants and thrombolytics, there's always the possibility that you will have stroke then, because especially if you dissolve the clots, no? Because they always go to the narrowest lumen, no? Clinical features of stroke.
Facial drooping, arm weakness, numbness or tingling unilaterally, slurred speech.
Okay. You can also have aphasia, diplopia. Diplopia is double vision, dysarthria. Next, what are the clinical features of hemorrhagic stroke?
Dizziness,
Yeah.
arthritis.
Hemorrhagic stroke.
It's an exploding headache, a decreased level of consciousness.
Okay. There's vomiting. Then rapid progression to
Vomiting.
coma. Severe hypertension. And what about ischemic stroke as compared to hemorrhagic stroke?
It's the timing, it's sudden, embolic, stuttering or slower, thrombotic.
So the progression is slower compared to hemorrhagic. Okay, blank is more sudden and blank is, of course, more slowly. Okay, we have
Embolic is more
two
sudden
types
and
of
thrombotic
ischemic.
is more slowly.
Yeah, embolic. Embolic is more sudden.
Embolic.
Thrombotic is slower. Next, a blood clot that develops in the blood vessel, reducing the flow of blood through the blood vessel. What do you call this?
Thrombosis.
Yeah, that's the process, the condition. So the thrombus is the blood clot. A piece of a blood clot becomes stuck in a blood vessel and obstructs the flow of blood.
Embolism.
Embolism. Did you know that this is so serious? No?
Yes.
Usual causes of cerebral vessel blockage or extravasation of blood.
Excessive fatigue injuring the interior, melancholic brooding, or excessive rage, dietary overindulgence, or excessive physical activity leading to blood stasis and blockage, internal accumulation of phlegm and
Okay. Next, causes coma and total or partial paralysis. So this is how it goes. No?
Chi deficiency and blood deficiency,
Mm.
disturbed flow of blood and chi, endogenous wind, fire, phlegm, and blood stasis, a blockage of or extravasation of blood from the cerebral vessels.
Okay. Aging and exhaustion will cause impaired regulation of yang qi, and this leads to what?
Kidney deficiency heat and liver deficiency heat.
Okay, very good. Kidney and liver pag aging. Emotional stress causes stagnation of liver qi and leads to
Liver excess fire and heart excess fire.
kidney deficiency. Yeah, liver excess fire. Sorry about this. Heart excess fire. Nagkamali. Okay. Improper diet causes impaired spleen, dampness, and phlegm, and this leads to
Spleen deficiency with phlegm.
deficiency with wind invasion, causes deficiency of original qi, and leads to
Unconsolidated channels.
good location of the stroke. Principally, what organ? Obviously, it's the
Heart, liver, spleen, and kidneys.
principally it affects the brain, no, and followed by the
Brain,
heart.
yes.
Yeah, heart, liver, spleen, and kidney. So take good care of your brain, take good care of your heart, liver, spleen, kidney. Pathological mechanism of wind stroke.
Deficiency yin or chi, fire, liver or heart, wind, liver or exogenous phlegm, wind or fire, blood stasis.
Okay.
And blood stasis.
Differential diagnosis of wind stroke that have loss of consciousness. What are these three? Puro may loss of consciousness.
Epilepsy, syncope, hypertonicity disorder.
Very good. Let's discuss epilepsy. The symptoms.
Uh, there's level of consciousness,
Mm.
tremors, muscle contraction, saliva, absence of sequelae,
Okay, that's loss of consciousness. Syncope
loss of
or symptom,
loss,
loss of consciousness, LOC. What about if you,
loss.
this is if you suddenly faint, no? That's syncope.
Loss of consciousness, pale complexion, and frigid extremities, no paralysis or contractions.
Then we have hypertonicity disorder. The symptoms are mm,
Rigidity of neck and back, muscular spasm, and tremors of the extremities, epistotenous, in severe cases.
good. Okay. When is, what do you mean by good prognosis for stroke? Or when is a stroke considered to have a good prognosis?
If there's reestablishment of motor and sensory coordination after recovery of consciousness.
Okay. Poor prognosis.
Um, Altered consciousness persists associated with hiccup, contractions, and frigidity of the four extremities, hematemesis, and blood in stools.
Okay. Treatment principle for the acute phase. Like you have an acute phase of stroke. Acute, huh? What do you focus on and what else do you do?
We focus on the branch, expel the pathogens, open the orifices, and awaken the spirit if there is a loss of consciousness.
Good. What about for the recovery phase? What is the treatment principle?
A combination of excess and deficiency manifests. Focus on pathogen that is not fully expelled and on the righteous chi. Support the righteous chi to expel pathogens.
Okay. Mahina talaga yung internet, no? Grabe.
Yeah.
It's really retrograde. Okay. Alam ko dito lang sa amin, dyan din pala. Nakaka-stress.
Yes, here also. Bagal.
Okay. Relevant biomedical disorders for wind stroke. It is very important that we know the medical equivalent of wind stroke. Okay, let's get
Um,
familiar.
T
Yeah.
TI oh, TIH, brain tumor, cranial arteritis, Bell's palsy.
Okay. What is the so TIA is a stroke precursor, no? Do you
Ay,
still have
wala na.
answers? Okay.
Wala na ako
So when you say
answer.
TIA or transient ischemic attack, this is a risk factor for ischemic stroke. In TIA, the arterial blockage in the brain occurs briefly and resolves on its own and will not cause tissue death. 10% of ischemic strokes are preceded by TIA. And 40% of patients who experience TIA will go on to actually have a stroke. Kaya kahit TIA lang yan, you need to be able to do something about it. So what happens in ischemic stroke? The clot will stop the blood supply to the area of the brain. So this is what we call ischemia, no? And 80% of strokes, everyone should know, are ischemic. They can develop in, so what we call the large vessel infarcts, major blood vessels on the surface of the brain, and then small vessel infarcts, small blood vessels deep in the brain. What are the types of ischemic stroke? Okay, there are three. We have the embolic infarct. Okay, the blood clot or the plaque wanders into the brain, so leading to DVT, deep venous thrombosis. Thrombotic infarct, blood clot or plaque will form in an artery. So there is high cholesterol. Lacunar infarct, small vessel blockages deep in the white matter of the brain. So diabetes mellitus and hypertension. Infarct of undetermined cause accounts for 30% of cases of ischemic stroke. Now, do you want to answer, Madam Trix? Ay, ala. Oh my God, wait lang. Ano ba to? Ang daming pas. Iparelax mo.
Doc.
Wait lang. Mark, iparelax mo. Wait lang.
Is it thrombosis?
Yeah. No, ischemic, embolic infarct. So when a blood clot forms in one part of the body, travels through the bloodstream, lodges in and obstructs a blood vessel in the brain. Embolic.
Embolic.
Travels siya. Next. What about this? Of course, 10 to 15% of cases occurs when the blood clot forms in an artery that supplies the brain, causing tissue death. Occurs as a result of plaque buildup in arteries, atherosclerosis, and develops over time. So this is thrombotic infarct. That's with C, infarct. Hindi yan infarct. 20% of cases, result of arterial blockage caused by high blood pressure. So pag ang nag-cause niyan is high blood pressure, that's called lacunar infarct. This is an ischemic type of stroke. Okay, the worst headache of my life, sasabihin ng pasyente. It occurs when blood vessel in the brain ruptures and bleeds into surrounding tissue. Bleeding compresses nearby blood vessels and deprives surrounding tissue of oxygen, causing stroke. This is Madam Trix.
No answer, Doc.
Hemorrhagic stroke. Hemorrhagic.
I guess bleeding.
What is intracerebral hemorrhage? So nasa brain, no? It occurs when the blood vessel inside the brain bursts and damages surrounding brain tissue. Hypertension is the most common cause of this type of hemorrhagic stroke. So if you have hypertension, you can have intracerebral hemorrhage. Subarachnoid hemorrhage, the bleeding occurs in the large artery on or near the surface of the brain and spills into the space between surfaces of brain and skull, often signaled by a sudden, severe thunderclap headache, commonly caused by ruptured aneurysm, which can develop with age or be genetically inherited. After the hemorrhage, vasa may cause the problem. Okay, let's compare the severity of ischemic versus hemorrhagic stroke. So people who suffer ischemic stroke have much better chance for survival than those who experience hemorrhagic strokes. Among ischemic stroke categories, the greatest dangers are posed by embolic strokes, followed by thrombotic and lacunar strokes. Okay. So we will continue next week. So I think this is like too much for everyone. Okay lang ba, Ma'am Trick?
Yes, Doc.
Yeah.
So I can answer.
Para hindi masyadong heavy, no? So parang I've noticed if we put in too many questions, parang nakaka-stress na din. So
And the Wi-Fi
thank you.
is dropped. Thank